see it? It's the card we signed yesterday.
Thank you very much. Thank you very much. I'm Brad Sherman from America's best named city, Sherman Oaks. We will organize. We'll send you an email. We'll see if you want to be involved in that. Now, that's why Caroline is circulating this email sign-up list. And I want to mention our next big town hall will probably be November 15th. Hopefully, that will not be yelling about health reform. That will be to celebrate health reform. But if for some reason the legislative process is not completed by then, it will be, the forces of darkness will make sure they show up, and I'm going to call upon you to be there as well. Now, I want to mention a couple of arguments to impart to the community in addition to all those you're studying. One was mentioned in the introduction, and that is a large number of people have health coverage. They like what they have. And that's an even larger percentage of the voters. And they think that the way to keep, some of them have been misled into thinking, that the way to keep what they have is to keep the laws the way they are. No. Under the program that we're all supporting, if you like what you have, you can keep it. That's been repeated over and over again. What has to get through is, if we don't change the law and you like what you have, you're going to lose it. But not all at once necessarily. But if you've got a Blue Cross card in your wallet, as I do, it's shrinking a little bit every month. You know that there's somebody in the industry you work in whose company is no longer providing health coverage. Or they've gone to some super high deductible plan. You're covered as soon as you have $10,000 of expenses. The co-pays are going up. The number of doctors participating in the PPO are going down. The portion deducted from your wages is going up the number of people who work with you who say, look, I just can't afford it anymore, don't take it out of my wages, I'll go without health care. The number of people voluntarily declining employer-provided or employer-partially provided health care is going up. And then you get the competition. Because if you work for a restaurant and the restaurant across the street isn't providing health coverage, your employer has to determine, can they provide health coverage? And if the fajitas across the street are now at a certain price, and the fajitas at your restaurant are at a certain price, how long will you have a Blue Cross card? And how long will that, and how wide and high will that Blue Cross card be as it shrinks millimeter by millimeter? And though everybody you talk to who says they've got coverage they like knows that that coverage is ebbing away slowly. And maybe you want to change employers. Will that new employer, that new opportunity provide health coverage? Not if we fail to adopt health reform. We're going to have universal coverage, or we're going to have eroding coverage. And so if you like what you have and you want to keep it, you had better demand change in Washington. And that's what this organization's efforts are all about. I also want to talk just a little bit about the birthers. They were out in force at my last town hall. George Washington did not produce his birth certificate. George W. Bush didn't produce his birth certificate. I run for office. Nobody asked me for my birth certificate. It's now not time to demean the first African American president. What we did do not where was Barack Obama born. The issue is he eligible to be President of the United States? Which is, was he a natural-born person? There doesn't seem to be any doubt about that. I don't see this anti-Caesarean movement anywhere. And while the Constitution says natural-born, I don't think anyone since Shakespeare has drawn a distinction between those who were untimely plucked from the womb of their mother and those who were born in the more traditional manner. So the issue is, was one of his parents an American? Yes. Obviously, yes. Now, the birthers would have you expunge the statute and the Constitution that makes it clear that no matter where on this planet, and a few of these folks perhaps other planets, no matter where you're born, if one of your parents is an American, you are an American citizen at that moment. Those who argue otherwise are not only castigating the Constitution and the statutes that have been there for over 100 years, they're also castigating John McCain, who was born in the Canal Zone, and while a few Yankee imperialists may disagree, the Canal Zone was never American territory. They are castigating then Governor George Romney, father of the one you know, who was the leading candidate for president among Republicans back in 1965. I see some folks who are old enough to remember that. And who was born in Mexico of American parents. But they're not just castigating those good Republicans. What are they saying about the men and women serving in Iraq, and Kuwait, and Germany, and South Korea? They're saying that their children are not eligible to become president of the United States, that the servicemen and women's children are inferior to their own children. Why don't they have the guts to say that to those in uniform? Why can't they go up and spit on those in uniform? They're not willing to do that because they don't have the courage to do it. But the fact is that there are children born in Kuwait today. Children born at Ramstead Air Force Base today. Children born in South Korea today. Whose parents are more American than those who aren't currently serving. And when you say that place of birth is decisive, you are attacking our men and women in uniform, and you ought to have the guts to say it to their face. Yeah. I look forward to working with you. If you want to contact our political office, and I look forward to working with you if there's any special election the next year, you'll need our phone number. That's why we put it on the comb. And I pass out the comb because so many of you have more use for a comb than I do. So the comb's in the back. Finally, I want to apologize for being late. I was supposed to be here at 11. As it happens, we got some fires. They do affect my district, and I've been involved in some conference calls. I now have to go visit some evacuees. So thank you for your work, and I look forward to making sure that we have health care for all Americans.